Ever wondered why the term menopause sparks a myriad of emotions among women? It's a word shrouded in mystery, often whispered and sometimes even feared. But why is this so? Menopause is not a disease or a disorder, it's a natural phase in women's life akin to puberty. It's the time when women's reproductive years wind down, a transition that every woman will experience. Yet it's often associated with misconceptions and fears stemming from a lack of understanding or misinformation. Some see it as an end, while others fear the changes it brings. But it's not about endings or drastic changes. It's about evolution, a new chapter in women's life. This transition can bring about various experiences, some challenging, others empowering. Let's take this journey together, strip away the fear and confusion, and reveal the truth about this natural biological process. It's high time we understand and demystify menopause for what it really is. So, what exactly is menopause and when it does typically occur? Let's delve into that. Menopause, in simplest terms, is the time in a woman's life when her menstrual periods stop and she can no longer become pregnant naturally. The process isn't abrupt. It's not an overnight transformation. It's a gradual transition that occurs over several years. This period is often referred to as perimenopause. Perimenopause is the bridge between fertility and menopause. It's time when ovaries gradually begin to make less estrogen. It usually starts in a woman's 40s but can start in the 30s or even earlier. Perimenopause lasts up until menopause, the point when the ovaries stop releasing eggs. In the last 1 to 2 years of perimenopause, the drop in estrogen accelerates. At this stage, many women experience menopause symptoms. Now, when does menopause typically occur? Well, the average age is around 50, but it can happen earlier or later. It's a unique journey for each woman. The biological changes brought about by menopause are primarily due to declining levels of estrogen and progesterone, two hormones produced in the ovaries. These changes can affect a woman's health and well-being, but remember, they are a normal part of life. So, here is the key distinction. Perimenopause is the transition, the journey. Menopause is the destination, the point when a woman has not had a menstrual period for 12 consecutive months. But let's clear a common misconception. Menopause is not an illness or a disorder that needs to be fixed. It's a natural biological process, a phase of life every woman goes through. It's a personal experience that varies greatly among women. While menopause can be challenging due to the physical and emotional changes it brings, it's essential to remember it's a natural progression, not a disease. It's a new chapter, a new phase of life, an opportunity to focus on personal growth, health, and wellness. Are hot flashes and mood swings all there is to menopause? Not quite. While these are common symptoms, each woman's menopause journey is as unique as she is. Along with hot flashes and mood swings, other typical symptoms include night sweats, sleep disturbances, and problems with memory or concentration. Some women may experience physical changes like dry skin or hair loss, while others contend with emotional shifts such as anxiety or depression. It also worth noting that symptoms can vary in severity and duration, from mild comfort for a few months to severe disruptions that last years. Remember, these experiences are not a sign of illness, but a natural part of life's journey. Understanding these symptoms can help you navigate this new phase with grace and preparedness. So, how can one manage the symptoms and maintain a healthy life during menopause? This is a question many women ask, and the answer lies in a multifaceted approach. the first strategy to consider is lifestyle changes. If you are having a symptom like hot flashes, drink cold water, sit or sleep near a fan, and dress in layers. Incorporating regular exercise in your daily routine can help to manage weight and promote better sleep. It also helps to prevent conditions like heart disease, diabetes, and osteoporosis, which can be vulnerable during menopause. Use an over-the-counter vaginal moisturizer or lubricant for vaginal dryness. Strengthen your pelvic floor muscles with Kegel exercises to prevent bladder leaks. Stay socially and mentally active to prevent memory problems. Don't smoke. Tobacco might cause early menopause and increase hot flashes. Eating a balanced diet is equally important. Foods rich in calcium and vitamin D can support bone health, while avoiding caffeine and alcohol may help with hot flashes and mood swings. Try to get half an hour of sunlight exposure daily. You can refer to my video on vitamin D and magnesium in my channel for more details. The link is given in description. Practicing yoga, deep breathing exercises or massage will help you to relax. And if you find yourself with extra time in your hand, picking up a new hobby or engaging in some creative activity can boost your confidence. Remember, self-care is very important during this phase. Now, let's talk about daily routine. Making a disciplined lifestyle is the best for keeping anxiety and tension away during menopause. Try including pranayama or breathing exercises in your daily routine. It helps to ease hot flashes. Now, let's talk about hormonal replacement therapy or HRT. This involves taking medications that replace the hormones your body stops producing during menopause. HRT can be very effective in relieving menopausal symptoms like hot flashes and night sweats. However, it's not suitable for everyone and may have potential risks. Therefore, it's crucial to discuss this option with a healthcare provider to weigh the benefits and risks. In addition to these conventional strategies, many women find relief through alternative therapies. These can include yoga, meditation, and herbal supplements. Again, it's important to consult a healthcare provider before starting any alternative therapy. Regardless of the management strategies you choose, regular health checkups are essential. It's important to monitor your heart health, bone density, and other aspects of your overall health during menopause. Regular screenings can help detect any potential issues early, allowing for timely intervention. To wrap up, managing menopause is not just about easing symptoms. It's about embracing healthy habits, exploring all your options, and keeping regular tabs on your overall health. This period of life can bring challenges, but with the right management strategies, it can also be a time of positive transformation. Menopause is not the end, but the beginning of a new chapter. How do we embrace this change? Well, the answer lies in acceptance and positivity. It's essential to understand that menopause is not a disease, but a natural stage of life like adolescence. Let's not view menopause as a decline, but rather as a climb to new heights. It's the start of a new journey, one where you are in the driver's seat. This journey is one best traveled with love and support of those around you. Family, friends, and healthcare professionals can provide the understanding and reassurance needed during this time. They can help dispel myths, provide clarity, and most importantly, they can provide a shoulder to lean on. Menopause is a journey, not a destination. With the right understanding and support, it can be a liberating and empowering phase of life. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to Health and Wellness by Dr. Uma Devi for more health tips and advice.